Good afternoon, everyone. My name is Peggy Myung. I'm a physician scientist in dermatology. Before I begin, I just want to make sure that we're all on the same page because it's fundamental to this technology. The same structure that gives us our hair and our teeth is the same structure that gives birds their feathers and reptiles their scales. That structure lies just beneath the skin surface, and in my lab, we're trying to recreate that structure to regrow hair. That structure is called the dermal condensate, or DC. DCs are composed of specialized dermal cells that initiate hair follicle formation during embryonic development, and in the adult, they are responsible for hair regrowth. However, the hair follicles you have are the ones you were born with, and if lost or destroyed, they cannot grow back on their own. Currently, there are no effective treatments that induce the formation of new hair follicles. The most common form of baldness is male pattern baldness, and as many of you know, many of the first-line treatments, including minoxidil, only slow down or delay the progressive loss of hair over time. Other more durable, noticeable hair treatments entail taking hair, pre-existing hair from uninvolved areas of scalp and then transplanting them onto balding areas. However, this procedure is costly, invasive, and frequently can't recreate the natural texture and density of hair, especially over the hairlines. Given that hair transplants cost over $10,000 per patient, we estimate the market value for effective novel treatments for alopecia or baldness is over $5 billion. Our approach is drastically different. What we want to do is we want to make brand new hair follicles in area of hair loss. By resurrecting embryonic programs of hair follicle development or formation. And as I mentioned to you before, the key to achieving this goal is to make DCs, hair-inducing DCs in skin. This would achieve two things. First, DC cells can initiate new hair follicle growth. And second, we can control the size of the hair follicle because we know that the number of dermal cells regulates hair shaft size. So what this means is that we can restore the youthful thickness of hair for both men and women while also recreating the natural gradient hairline so it doesn't appear artificial as what you typically see after hair transplants. However, the major barrier to using DCs to make new hair is the fact that the molecular signals required to generate DC cells in the first place have been unknown for decades. Well, that changed recently. Our lab was the first lab to identify the key signals required to generate DC cells. We call these signals signal X and signal Y. We showed that these two signals together are necessary and sufficient to form DCs in a mouse model. Further, we show that the level and duration of these DCs, of these signals can modulate DC size and therefore hair thickness. Currently, we are at the next step of wanting to determine the dose and duration of signal X and Y that can modulate the size and formation of hair follicles or of DCs. For this, we generated a more efficient model to test this by developing the first in vitro dermal in vitro culture model that can generate DC cells using chemical agonists of signal X and signal Y. So generally what we're doing is we're taking cells from a non-DC state and then programming and propagating them into a DC state, which cannot be done with other standard state-of-the-art in vitro models. So this accelerator award would be critical for us at this dose and duration stage. Specifically, we want to use this in vitro model to test specifically the different doses and duration of signal X and Y that is necessary for optimal DC gene expression and DC expansion. And second, we want to verify and measure the ability of these cultured DC cells to make new hair follicles using a standard live animal hair growth model. We estimate the cost of these experiments will be about $28,000. These groundwork experiments will set the stage for being able to then transition into developing small molecules for human drug delivery. This could be either topically as an ointment or cream that can be applied on top of the skin or injected intradermally, somewhat akin to Botox injections. Finally, ultimately, we expect that our first patient test population will include patients with male pattern baldness. And finally, I'd like to thank you for all of your attention and for giving us this opportunity to present our research.
I felt like I was the model standing up there. However, questions from our judges would be welcome. Not signal. Yeah, okay.
Just in terms of potential tumorigenicity, to what extent has that been explored, or just safety in general with the X and Y?
That's a great question. So I think the true beauty of this model is that it's once it's given, it's done. Meaning, once you make the DCs and they can initiate hair follicle formation, you no longer need continued chronic, exposure to these chemicals. The hair kind of is a self-perpetuating factory at that point. So really, you just need to make the DCs, and then they're able to induce the hair follicle, and then it's done, and you have a permanent hair follicle.
Thank you very much.